Phobias causes and treatment causes. It is unusual for a phobia to develop after the age of 30, with the majority developing during childhood, adolescence, or early adulthood. They can be brought on by a stressful experience, a terrifying event, or a parent or household member who has a phobia that a child can learn. Specific phobias. These typically appear before the age of 4 to 8 years. It could be the result of a traumatic early experience in some cases. Claustrophobia, for example, may develop over time after a younger child has an unpleasant experience in a confined space. Childhood phobias can also be triggered by witnessing the phobia of a family member. Arachnophobia is much more likely to develop in a child whose mother has the phobia. How the brain works during the phobia. Some areas of the brain store and recall dangerous or potentially deadly events. If a person faces a similar event later on in life, those areas of the brain retrieve the stressful memory, sometimes more than once. This causes the body to experience the same reaction. In a phobia, the areas of the brain that deal with fear and stress keep retrieving the frightening event inappropriately. Researchers have found that phobias are often linked to the amygdala, which lies behind the pituitary gland in the brain. The amygdala can trigger the release of fight or flight hormones. These put the body and mind in a highly alert and stressed state. Treatment. Phobias are highly treatable, and those who suffer from them are almost always aware of their condition. This greatly aids diagnosis. Speaking with a psychologist or psychiatrist is a good place to start when dealing with an existing phobia. Most people find that simply avoiding the source of their fear helps them stay in control if the phobia does not cause severe problems. Many people who suffer from specific phobias do not seek treatment because their fears are often manageable. The doctor, psychiatrist, or psychologist may recommend behavioral therapy, medications, or a combination of both. Therapy is aimed at reducing fear and anxiety symptoms and helping people manage their reactions to the object of their phobia. Medications. The following medications are effective for the treatment of phobias. Beta blockers. These can help reduce the physical signs of anxiety that can accompany a phobia. Side effects may include an upset stomach, fatigue, insomnia, and cold fingers. People with phobias are frequently prescribed serotonin reuptake inhibitors, SSRIs. They have an effect on serotonin levels in the brain, which can lead to improved moods. SSRIs can cause nausea, sleeping problems, and headaches at first. Tranquilizers. Benzodiazepines are an example of a tranquilizer that might be prescribed for a phobia. These may help reduce anxiety symptoms. People with a history of alcohol dependence should not be given sedatives. Behavioral therapy. There are several therapeutic options for dealing with a phobia. Desensitization, also known as exposure therapy. This can help people with phobias change their reaction to the source of their fear. In a series of escalating steps, they are gradually exposed to the source of their phobia. A person suffering from aerophobia, or a fear of flying, may, for example, take the following steps under supervision. They will first think about flying. The therapist will have them look at pictures of planes. The person will go to an airport. They will escalate further by sitting in a practice simulated airplane cabin. Finally, they will board a plane. Cognitive behavioral therapy, CBT. The doctor, therapist, or counselor assists the person suffering from a phobia in learning new ways of understanding and responding to the source of their phobia. This can help with coping. Most importantly, CBT can teach a phobia sufferer to control their own feelings and thoughts.